want to pretend I've already cleaned her teeth. And, you know, it's really important to, sometimes in a busy office, you got the patient back and you're looking at them. You know, you're grabbing moments whenever you can get them. This is the ideal scenario. But even if they're back or they're up, you need to maintain that eye contact and want to make sure that you're never back here. So let's assume that she's done, and we kind of looked around. I've told her a few things, but we're going to start talking about plaque in her mouth. So here we go. I'm done. I brought her up. I'll say, okay, Mrs. Snell, I showed you a few areas in your mouth where possibly you were missing plaque. We're going to talk about plaque, but you were doing very well in a lot of areas. But we're going to talk about what causes disease in your mouth, in all of our mouths, and how we can hopefully prevent it. First off, I kind of showed you where some plaque was being left. You were doing very well in other areas, but tell me what you know about plaque. Do you know what it's made of? Or more importantly, what's in plaque that causes so much problems?
Isn't plaque that stuff that I see on the commercials for that you can just buy something that kind of rinses it off and it can get hard on your teeth?
That's true. It can get hard on your teeth if it isn't removed. There is a rinse, I believe, called plaques, but technically, plaque can't be removed by rinsing. The best way I can describe it in your mouth is, do you wake up in the morning ever and you just feel like you got the slime over your teeth? It just feels fuzzy? Or okay, that's plaque forming on your teeth. You might have brushed perfectly the night before, but plaque forms immediately after that. It forms every 24 hours. Even if you don't eat, it still forms, and it's made up of just the saliva and the bacteria that's in your mouth. But the problem with plaque is if we don't remove it thoroughly every day, either perfectly once a day, but since none of us are perfect, twice a day is what I would recommend. If we don't get rid of it, it causes the disease in our mouth, cavities or gum disease. So, and the plaque affects both of those a little bit differently. When we're talking about cavities, when you've got the bacteria and the plaque on your teeth, it's not removed. And let's say you've had bad sugar or even natural sugars. When those two act together on your teeth, it produces an acid. And so what does an acid do?
Probably eats a hole in something?
It does. So that's how we get the cavities. Plaque not removed, the sugars in our diet, even the good sugars, react to form a cavity. Now, plaque behaves a little bit differently when we're talking about gum disease or gingivitis or periodontal disease. If the plaque is underneath that little, I showed you before about that little sulcus or little cuff area right at the top, if we don't get the plaque out of that area, it builds up. It eventually hardens where it becomes calculus and we can't remove it. More plaque forms, and it really causes inflammation and disease in our tissue. If it's just the tissue, our gums that are affected, we can turn that around by removing the calculus, removing the plaque, and we get healing. But if it continues and your gums, instead of a 3 millimeter little cuff, it gets much larger than that, you can't clean it yourself. And we get to the point, most people don't realize what's really holding our teeth in. It's not gums, but it's bone structure. And if the disease progresses, we lose bone, the teeth get loose, and you lose them. So we want to prevent that from happening. Right now, in your mouth, you've got a fairly healthy mouth. Maybe just the beginning of gum disease, which is called gingivitis, but our bone still looks really great. So we can turn this around by great brushing and flossing. As we progress, you can see the next step, a little more inflammation. The bone has been eroded away. We have more depth in our little pocket area as compared to healthy over here. Does that make sense?
Mm-hmm.
So,
good.
What we got to do is we got to get the plaque out of your mouth. So while you're doing a good job in some areas, I just want to show you a different technique that you might want to implement that is supposed to be the Cadillac of all brushing techniques, and we'll see what you think about that, okay? Okay. All right. So,
You know how to do that, Jessie? No. It's around the button over here by the refrigerator. I'm sorry. I just thought I'd help you. Oh, Jessie, it's over here on this corner by the I'm sorry.
let's pretend first. I'm going to show you how to brush and floss on the model, and we'll get that all out of the way, then we'll go to your mouth, okay? All right, so here we are. And this technique is called the modified bass, or the bass. But the main thing is, what differentiates it with other toothbrushing techniques is that we, first of all, have a very soft brush. That's so, so important, very soft. Soft is good because it doesn't hurt our gum tissue, and it cleans the teeth just as well as a hard, and doesn't damage things. So, we'll wipe this off. Okay, so here we are. We are, okay, here we go. Let's do this. Here we are. Okay, 45-degree angle. We're trying to not force those bristles in there, but we're just trying to gently focus those bristles underneath into that sulcus, or that little cuff that's there, and do a gentle little wiggle. Stay there a little while, brush down or away. Do it again. Go to the next area, overlap your strokes so we don't miss any area. And you might notice how I'm doing this very systematically. I'm not kind of going in and giving it the old whirl, because you miss areas that way. So really important to start in an area, progress it around, do the insides, go to your lowers, do the same thing. Very organized, we're not going to miss any areas. So as we go around, same thing, soft brush, sweep. Soft little jiggle, sweep. All the way around, do the same up here. Say we get up there and we 45-degree, jiggle, jiggle, jiggle. It's a little awkward here, but practice will make perfect. Sweep. The only difference here are two things. When you get to your front area on the inside, it's really hard to fit your brush like that, so we go from a horizontal position to a vertical. Jiggle, 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 flush. Jiggle, 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 flush out. Do that again there, and don't forget to follow up with what we call occlusal, or biting surface brushing. And that's totally different. You just pretty much go really hard trying to direct those bristles into those pits and fissures, those deep areas on the top of our teeth, both. Okay. So then you progress to the lower, same thing, but on the lower, jiggle, jiggle, sweep up. Okay, instead of down on the upper. You're always sweeping towards the biting surface, chewing or biting surface. Okay, why don't you show me? Does that make sense?
Yeah, I think it makes sense.
Okay, thank you.
I've never done that, so it seems like that would take a lot of time to brush like. You just brush like this?
It does. In fact, okay, let's slow down just a little bit. Okay, angle. Do your angle a little bit more like this. Softer jiggles, gentle, sweep, and then do it again. Gentle, sweep. Now keep progressing. Now you brought up a good point about how much time it takes. To do it correctly, it takes a good 3 minutes of brushing, okay? That's important, twice a day.
Yeah, that would take a lot of time.
So you would progress around. Let's do the inside. Okay. Okay, let's slow it down again, like we did before. Angle that brush a little bit. Sweep. Slow down. Do it again in the area. There you go. Very nice. Okay, show me there. Show me how you do it in the front areas. Let's try to move our brush vertically. Let me guide you. Okay. Does that make sense?
It's a lot more easy to get in that little area.
Okay. I'm going to have you do one more area really quickly. Let's go to the lower. Now we would normally start in one area, but we're going to just show me how you would do it on the tongue side there. Let's, at the gum tissue, a little bit more 45, and then sweep up. Overlapping very nicely.
Okay.
I think she's got it. Okay, good job. And we'll do it in your mouth so you can feel a little bit better about it. Flossing. So you can see where brushing gets the outsides, the insides, the tops. But a lot of the decay, as well as on the chewing surfaces, is in between the teeth. You cannot get those areas with the toothbrush. You just don't get them. So we're gonna do some flossing. I'm gonna grab one of those flosses. We'll use one on the model and then a different one when you go inside your own mouth. Okay, maybe I should show first, just a little bit. So we got about an arm's length or half an arm's length or what, close to that. And we wrap it mostly around our middle fingers. Start out loose, it's going to get tight, it's unavoidable. A little bit around the other one. So I've got it really tight and I can control that area. Then I use these fingers together, any combination to guide my floss and make it do what I want it to. I'll have you hold this for me a moment, please. So, the only time you seesaw is when you're going down. Seesaw to get through the contact. Be careful, we don't want to hurt that gum tissue that's filling up that space. So I go to one side of the gum and I wrap it as well as I can and still control the floss. And I go up and down like I'm scaling a wall until it really starts feeling squeaky clean. If you got plaque there, all of a sudden it feels better, it feels cleaner. And I'm gently going underneath that gum tissue. You know, don't ram it down there, but just very gently trying to get that plaque out from that normal little sulcus area, that little. Let's go up and over the gum tissue, go to the other area, and I'm going up and down. I'm seeing it, I'm wrapping it, and I'm really trying to get as much plaque out as I can. Okay, I keep slipping out. But once you've done that, then you seesaw back. Same thing. Make it organized and systematic. Once a day, you should be flossing. Start behind the very last tooth, work your way all the way around, and then do the lowers. Okay. So we don't want to miss any areas. Okay. I think what we need to do is wrap it a little bit more. You've got too much that you're using. Oh, sorry. Sorry about that.
It's okay.
Okay. Seesaw down. Okay. Now let's wrap it a little bit more. There you go. Seesaw. Once you're down, wrap it, guide it up and down, going underneath the gum tissue. Very good. Now stay down there and go up over the gum tissue and do the other tooth that you're in between, up and down. Good that you're not doing any seesaws.
Okay.
Very nice. Okay, that's probably enough demonstration. I'll take your floss.
Okay.
And why don't we're going to see the plaque in your mouth first, so we can kind of see. You brushed today, I'm assuming. So, and you probably tried to do a really good job. She didn't really, so we could find some things. And so I'm going to have you take a disclosing tablet, chew it up really good, spit it out, then rinse, and then we'll show up where you might be missing some more plaque. I know we talked a little bit about it earlier, but this will really show us. If you want to grab that toothbrush, and we're going to look. I didn't wait long enough. These black coats have seen better days, haven't they? Any questions so far?
I don't think so. I don't like to, I'm kind of on the go a lot, so I don't know that I spend very much time on my teeth.
It does take time to remove the plaque and the bacteria, more importantly. So can